Hey guys, welcome and welcome back to my channel. This is Dr. Prasanjit, currently JR2 in the Department of Pharmacology, AIMS Kalyani, and I am back with one of my presentations. So without wasting any time further, let's get into today's topic. So today I'm going to discuss about the topic self-medication. So it is basically an awareness creating class for the undergraduate students, that is the MBBS students. So in today's class, I will be discussing the topic under the following headings, that is the background comprising of the definition and introduction to self-medication, then the criteria for self-medication product, reasons for self-medication, commonly self-medicated drugs, benefits and risk of self-medication, responsible self-medication practices. Then we have ethical responsibilities, some of the case studies related to self-medication associated ADRs, that is adverse drug reaction, and finally conclusion. So first, coming to the definition, according to WHO, what do we mean by self-medication? So WHO has defined self-medication as the use of drugs to treat self-diagnosed disorders or symptoms, or the intermittent or continued use of prescribed drugs for a chronic or recurrent disease or symptoms. So it is basically self-medication, that is, as the self-medication is basically the use of drugs to treat the self-diagnosed disorders. Okay, so these are the key terms, that is self-diagnosed disorders or symptoms, or using it for some of the conditions like chronic or recurrent diseases. So this is basically the definition of self-medication by World Health Organization. And in practice, it is also including the use of medication of the family members, especially when the treatment is of the children or the elderly. Basically, suppose if the drug is being prescribed to some other individual, and if we are using the same drugs without getting the prescription for the children and the elderly people, which is being commonly done in some of the families, so in that case we can say that is also a part of self-medication, because there also we are not taking the prescription from the doctor, we are prescribing ourselves. So that will also come under self-medication, which is very common in the Indian scenario. Now coming to the introduction. So basically, self-medication is an important public health problem, as you know, with a prevalence ranging from 11.7% to 92% across the world. So basically, the prevalence varies from countries to countries, and in countries like India, which is a developing country, there we have usually a greater prevalence of self-medication. So the practice of self-medication is widely prevalent in developing countries like India. This is because relatively easy access is there for a wide range of over-the-counter drugs. Okay, so in India we have access to over-the-counter drugs, like easily access to over-the-counter drugs, and sometimes some of the pharmacies even provide the drugs which are prescription only drugs without the doctor's prescription. So this is the reason why self-medication is increasing in countries like India, which is a developing country, and the high prevalence of the self-medication in India is one of the important factors which is attributing to the development of antimicrobial resistance. As you might be knowing, like most of us, whenever we are having fever, instead of going to the doctor, we sometimes directly self-medicate ourselves with the help of some antibiotic and some of the antibiotics, and this is the reason that it leads to development of the antimicrobial resistance, and also self-medication leads to further other serious health hazards. So this is the introduction to self-medication, that the prevalence is increasing basically in the developing countries like India because of the easy access to over-the-counter drugs, and also to the prescription-only drugs, that is the drugs which can be given only after getting a valid prescription from a registered medical practitioner. And because we are continuously self-medicating us with some of the drugs like antibiotics, it has promoted the development of antimicrobial resistance. So this is the reason why we can say that self-medication is a double-edged sword. So what do we mean by the double-edged sword here? It means that self-medication is good also and it is bad also. So when is self-medication considered to be good and beneficial? This is when we do responsible self-medication. In that case, we can say it is a benefit for the society. So whenever we are doing self-medication, that is responsibly, okay, that is we know which drug is to be used for which particular condition. Like suppose self-medication can be used readily to relieve some of the acute medical problems, and this might be economical for the individual also, because in that case he or she doesn't have to go to the hospital also. And sometimes self-medication can be even life-saving in case of some of the emergency medical situations. So in that case, it is acting as a benefit for the individual. And when the self-medication is done without the sufficient knowledge, it may lead to irrational use of drugs, causing serious negative health impacts, that is in the form of adverse drug reactions, in the form of drug interactions. So in that case, it is not acting as a benefit. So this is the reason why it is a double-edged sword, and when we are doing a responsible self-medication, we are actually providing benefit to the society. So that is why some of the governments all over the world are even increasingly encouraging self-care for minor illnesses. Okay, that is some of the minor illnesses which can be treated with the self-medication. So in that case, we can go for self-medication. So this is about the self-medication as a whole, about the background. Now let's discuss about the criteria for self-medication products, like the products which can be used for self-medication, like which we can use to treat ourselves, like without getting the prescription basically. So it has to follow at least the following three criteria. First thing, the active ingredient of the drug, that is at the intended dose, should have low inherent toxicity. That is, it should not produce any reproductive toxicity or any genotoxicity or any carcinogenic properties, that is, or any carcinogenic potential. So the active ingredient should be inherently less toxic in nature. Then that becomes one of the criteria for using that drug as a self-medication. Then next, the intended use of that particular drug should be appropriate for self-medication. That is, use of the product should not unduly delay the diagnosis and also the treatment of a condition which actually requires medical attention. So basically, we can use self-medication for conditions only when it is not going to disturb the diagnosis and delay the diagnosis, and also it can sometimes hamper the treatment process, that is, which require medical attention and consultation with the doctor. So in that case, we cannot use self-medication. But if it is not hampering the diagnosis and not affecting the treatment, then in that case also we can consider that as a criteria for self-medication. Then the product should not have the properties that make it undesirable. Example, the drug has a significant risk of dependence or abuse. If a drug is having a significant risk of dependence or abuse, then it should not be self-medicated. Or suppose if the drug is having interaction with the commonly used other medicines, like some of the medicines which we commonly use are like proton pump inhibitors, then sometimes we are using antipyretics to control fever, and food. So if we take some medication which is shown to have interactions with the commonly used medicines or the food which we take, leading to the development of adverse drug reactions, then in that case that cannot be a self-medication product. So it should not have any properties which is undesirable, that is, it should not have a tendency of abuse or dependence, and it should not have any drug interaction with other drugs, or it should not have any interaction with the food which we are normally taking. So if these three criteria is met, then only it can be said that the product can be self-medicated. Now coming to the reasons for self-medication. So this can be under the following categories. So it can be individual factors, it can be economic factors, it can be physician related factors, it can be cultural factors, and it can be the impact of media. So under individual factors, we are having following categories. That is, if the individual is having medication information, that is, he knows about the medicine, then it will be a tendency of that individual to self-medicate. If the individual is having any previous experience with the same medication, that it has relieved the symptoms which he was having earlier and now he's facing the same symptom, then in that case also that person will be trying to do self-medication. If the individual is having easy access to the medicine, then also it is going to promote self-medication. If the individual is having less time, that is less time for going and consulting a doctor, so in that case also the individual can self-medicate. And if the individual is not taking the disease seriously, that is, he or she is not at all bothered about the disease, so in that case that person might go for self-medication. Now coming to economic factors, individuals try to self-medicate so as to decrease the cost of the visit to doctors and decrease the cost of the paraclinical services. That's basically the tests which are being done along with the diagnosis for the purpose of diagnosis, and to decrease the travel cost. So these are come under the economic factors which are promoting self-medication. Then physician related factors. Suppose if the clinic is crowded, in that case individuals will not prefer to go there and have a consultation with the doctor. Suppose if the doctor is having inadequate respect for the patient's privacy and low quality treatment, in that case all the individuals will be trying to self-medicate themselves. Then coming to the cultural factors, that is basically the acceptance of self-medication in the society. That is, nowadays many people are self-medicating themselves for some of the conditions like fever, cold, cough, rhinorrhea, headache, etc. So for that, many of the people are doing the self-medication. And media impact, that is basically the advertisements by the pharmaceutical companies, can also promote self-medication, where they provide information about the symptoms and the drug which they can use for that. So this can also promote self-medication, because individual is getting information regarding the particular drug. So these are the broad categories under which we can classify the reasons for self-medication. Now coming to the commonly self-medicated drugs, so under this I have included these following drugs. Apart from this, there can be other drugs also. So first we have antibiotics, then we have analgesics, then we have antipyretics, then we have sleeping pills, then we have proton pump inhibitors, antihistaminics, and herbal medicines. So all these are commonly self-medicated drugs. So let's discuss about this one by one. So coming to first, antibiotics. So in India, despite being prescription drugs, like these antibiotics being the prescription drugs, many pharmacies sell antibiotics freely as over-the-counter drug. That is bypassing the legal restriction, which is one of the reason leading to increased tendency of doing self-medication for the antibiotics. Then adding to this issue is the pressure which the patients often place on the doctors to prescribe the antibiotics for conditions which don't even require the use of antibiotics, like fever, cough, and cold, and acute diarrhea, which are usually typical viral in nature and are self-limiting. So in that case, basically they don't need antibiotics, but the patients put pressure on the doctors so as to get antibiotics, that is, so as to make them prescribe antibiotics for themselves. So this is one of the reasons why there is increased self-medication of antibiotics, and this leads to self-medication with incorrect dosage and inappropriate drugs, leading to incomplete treatment and also development of the antimicrobial resistance. That is, more the antibiotics are misused, the greater is the chance for the bacteria to develop the resistance. So that is the reason why India has become a global hotspot for antibiotic resistance, that is, with many bacteria becoming resistant to the first line treatments of several diseases. We have multi-drug resistant tuberculosis, then we also have methicillin resistant staphylococcus aureus infections. So this is because of the irrational use of antibiotics. So stricter enforcement of prescription only sales of antibiotics is to be done. This will decrease the self-medication tendency, that is, basically it will decrease the self-medication, at least for the antibiotics. So this will actually decrease the chances of development of antimicrobial resistance also. Now coming to the next category, that is analgesics, which is used for relieving the pain. So they relieve the pain, but they do not address the underlying cause. So what is the mechanism of action? That is, they either reduce the inflammation at the site of pain, or they change the brain's perception of pain. So basically they can reduce the inflammation, but they are not going to treat the underlying cause. So this is the reason why analgesics, they are used as self-medications, but this will actually delay the diagnosis process. That is, they are going to mask the underlying symptoms. So analgesics are used for a wide range of conditions like cancer, then gastrointestinal disorders, then we have headache, infection, dysmenorrhea, migraine, osteoarthritis, rheumatoid arthritis, trauma, toothache. So in all these cases, we are using analgesics, and they are commonly self-medicated because of their easy access and the immediate relief which they provide from the symptoms, and also most of the analgesics are relatively safer. That is the reason why people do not hesitate while taking the analgesics by themselves. So these are some of the reasons why analgesics are one of the commonly self-medicated drugs. Then we have antibiotics. So under this we have paracetamol, which is a widely used over-the-counter pain reliever, fever reducer, and it is also used in cold and flu-like symptoms. So it is commonly self-medicated as it is available as OTC drug, that is without any doubt, that is without any prescription. It is being provided, so, and it is also relatively safe, affordable, and it is having relatively fewer side effects, and it is versatile in its action. That is, basically it is used for relieving the pain, it is used for even decreasing the body temperature also. So that is why irrational use of paracetamol occurs, and this leads to several problems like liver toxicity when we take paracetamol at a very high dose, and it also masks the underlying condition. That is, this fever is basically a symptom of an underlying disease which is usually masked when we control the fever with the help of antipyretics like paracetamol. And coming to the safe usage, that is recommended safe usage of paracetamol, that is, it should not exceed a maximum daily limit of 4000 milligram in case of adults. So if it goes beyond 4000 milligram per adults, then it will be considered as paracetamol toxicity. Then we come to sleeping pills. So these are basically non-benzodiazepine hypnotics, which are also known as Z drugs, example zolpidem and zaleplon. So they bind to the same GABA receptors in the brain, where the benzodiazepines are also binding. But the advantage with these Z compounds is that they are believed to have fewer side effects compared to benzodiazepines. So usually doctors prescribe these sleeping pills for short duration, that is for the management of insomnia. But people start using these sleeping pills anytime when they feel trouble in sleeping or whenever they are anxious. So in such conditions, there might be some situations where they don't even need the sleeping pills for their insomnia, which is just because of some stress. In that case also they will be using the sleeping pills, which leads to dependence on the sleeping pills. And at higher doses, the sleeping pills also produce the same drowsy and addictive effects just like the benzodiazepines. So this is about the sleeping pills like zolpidem and xarelto, which are also called as the Z drugs. Now continuing with the sleeping pills. So what happens is, over the time when the individual is taking sleeping pills continuously, the brain gets accustomed to this effect, and then recovery gets harder. That is, whenever an individual who is an addict to the sleeping pill, he will try to recover. That is, he or she will stop using the sleeping pills. Then in that case, the individual will suffer from something which is called as rebound insomnia. That is, again there will be development of insomnia, or sometimes individuals might even have compounded insomnia. That is an insomnia which can be due to multiple overlapping factors. So this is even worse than the insomnia from which he or she was suffering before taking the sleeping pills. So what this side effect does, this rebound insomnia or the compounded insomnia, it becomes a problem for the individual to recover from the sleeping pill addiction. So this is the common side effect which is used as an excuse by the sleeping pill addicts for stopping the use of sleeping pills. And also, when the individuals are on sleeping pills, they do not read the warning labels which are being provided in the pill bottle, that is the medication label. And some of the addicts, they also drink alcohol along with that. So it can lead to grievous adverse drug reactions, that is taking sleeping pills along with alcohol. So this is about sleeping pills. Now let's discuss about proton pump inhibitors. So proton pump inhibitors, that is PPIs, they are the drug of choice for gastroesophageal reflux disease, any acid related disorder that is in the stomach. Then we have eosinophilic esophagitis, then Barrett esophagus, which is because of gastrointestinal reflux disease. If gastrointestinal reflux disease is present for a longer duration, that is, if it is persistent, then it can lead to Barrett esophagus. It is also used for prevention of the gastrointestinal bleeding while the individual is on non-steroidal anti-inflammatory drugs, also used in eosinophilic esophagitis and peptic ulcer disease. So as you can see, proton pump inhibitors are having a wide range of use, and that's why there is a significant increase in the use of PPIs for ill-defined indications. And this is actually a concern. That is, sometimes it might not be this disease, but the individual, if individual is facing some trouble like dyspepsia or something like that, which can be a symptom of an underlying disease, the individual will try to take proton pump inhibitors by himself or herself, and that will lead to masking of the disease, which has actually led to the dyspepsia. So this is a serious issue. Now, coming to the different adverse outcomes which can occur by the use of the proton pump inhibitor, so it is usually categorized into the following, that is, something which is unrelated to the acid inhibition and something which is related to the acid inhibition property of PPS, that is acid inhibition property of PPI, and one which is not related to the acid inhibition property of proton pump inhibitors. So under this we are having allergic reactions which can occur, then acute interstitial nephritis, chronic kidney disease, then some of the poor cardiovascular outcomes and dementia. So all these are not related to the inhibitory action of the proton pump inhibitors on the gastric acid secretion, but they can occur as an adverse effect. And when there is decreased gastric acid production, it leads to increased gastrointestinal infection, it leads to nutrient deficiency because it alters the absorption process. Then it can also lead to spontaneous bacterial peritonitis because there can be increase in the gastrointestinal infections, and then it might enter into the peritoneal cavity leading to spontaneous bacterial peritonitis. Also there can be small intestinal bacterial overgrowth, and since there is no production of gastric acid from the stomach, it leads to atrophy of the stomach leading to atrophic gastritis. So all these are related to the inhibitory action of proton pump inhibitors on the acid production by the stomach. So these are the adverse effects, one related to the acid inhibition and the other one which is not related to acid inhibition property of proton pump inhibitors. So what can be the measure which we can take so as to decrease the irrational use of proton pump inhibitors? That is, we can do deprescribing. That is deprescribing. So what is deprescribing? It is basically a programmed reduction in the drug number or dosage of inappropriate medications which is supervised by a healthcare professional with a goal of reducing the adverse outcomes associated with the overuse of that particular drug. But there are several barriers to deprescribing PPIs. That is, one, patient may firmly believe that proton pump inhibitors improve the quality of their life and values, and such individuals are actually not preferring to quit proton pump inhibitors completely. Rather, they will be on intermittent use or on demand use of proton pump inhibitor. So these are some of the barriers to deprescribing which is used as a method of decreasing the irrational use of proton pump inhibitors. So deprescribing and the barriers to deprescribing, that individual thinks that it improves the quality of the life, so as a result they will not completely avoid the proton pump inhibitors, they will be on intermittent use of proton pump inhibitors or on demand use of proton pump inhibitors. Now coming to the next category, that is antihistaminics. So they are used in several conditions like allergic reactions, allergic rhinitis, urticaria, which is basically an allergic condition. Then we have common cold symptoms, insect bite reactions, motion sickness, sleep disorders. So it is commonly self-medicated because of its wide variety of use and because of its over-the-counter availability. Plus, it provides quick symptom relief. It is affordable. It can be present in various formulations like oral, topical, and also it is relatively safer. This is the reason why antihistaminics are commonly self-medicated. Now coming to the herbal medicine. So nowadays individuals are even preferring the herbal medicines, that is they are trying to shift to some of the alternate medicines. So herbal remedies basically consist of the potions or the plants or unpurified plant extracts containing several constituents which are often generally believed to work synergistically and to show the therapeutic effect. But for most of the things which are given in the herbal medications, like individuals they take it from some quacks, in that case they don't have any proved efficacy. So that is the reason why it leads to several adverse effects, as you can see. Next is the reason for increased use of herbal remedies. Why do we increasingly use herbal remedies? That is why there is a shift to herbal remedies. That is because of the various claims of their increased efficacy and effectiveness over the conventional therapies which we are using. Then the consumers' interest in the alternative medicines, that is they are not satisfied with their present medication. Then also the high cost of the modern drugs which are usually being prescribed by the registered medical practitioner, their high cost and some of the adverse effects associated with it, and patients being uncomfortable about discussing their medical problems and fear the lack of confidentiality when consulting a doctor. So in that case they might resort to herbal medicines. Also there can be another reason, like individual is lacking time to see the physician, so in that case individual self-medicates himself or herself with some of the herbal medications available. Most of the countries, what happens is these herbal medicines and related products, they are introduced into the market without any mandatory safety or toxicological evaluation, unlike the drugs which are being prescribed by the registered medical practitioner. So they are released into the market without any mandatory safety or toxicology evaluation, and herbs have shown to be capable of producing a wide range of undesirable or adverse reactions, some of which can even lead to serious injuries and life-threatening conditions. Even it can lead to death of the individual. Now coming to some of the herbal medicines which are being used, as you can see here, this is ephedra, which is used for some of the respiratory conditions, and it leads to adverse effects like hepatotoxicity and transient blindness in the individual. Then we have aconitum, which is used for relieving the pain, and it leads to several serious ventricular tachycardia and fibrillations which are even life threatening. Then we have the garlic extract, which is being commonly used for hypertension and to control hypercholesterolemia, but they can cause nausea and lightheadedness. So these are some of the examples of the commonly used herbal medicines for self-medication. Now let's discuss about the benefits and risk of self-medication. So first we will discuss about the benefits of self-medication. So at an individual, what are the benefits, and at a community level, what is the benefit of self-medication? So at an individual level, when we are doing self-medication, the person plays an active role in his or her own healthcare. So the individual is aware of his or her condition and plays an active role in treating himself or herself. So this is one advantage. Then individual keeps on educating himself or herself, that is education opportunities on specific health issues, like what are the different products which are used to treat the common symptoms and the common diseases which are usually faced by most of the individuals. Then it is convenient basically, because you don't have to go for consultation, like you don't have to go and consult a doctor. It saves your time plus saves your money, so overall economical benefit also. Then we have benefits at the community level. So it helps in saving scarce medical resources from being wasted on minor conditions. Like suppose if the individual is having some minor symptoms or minor conditions, in that case self medication helps in saving the resources. Then it also lowers the costs of community funded healthcare programs if the individual self medicate themselves. Then it reduces the absenteeism, that is sickness absenteeism basically, of the individuals from work due to minor symptoms. That is, if the individual is having some minor symptoms, then if they know their symptoms properly and have a proper idea about the drugs which can be used safely for the management of the symptom, then it reduces the sickness absenteeism. Then it also reduces the pressure on medical services where the healthcare personnel are insufficient in number. So in that case also self medication plays an important role, and it is having an advantage in that case. So these are basically the benefits of self medication. Now let's discuss about the risks. So because of this, it leads to incorrect self diagnosis. Suppose if the individual is diagnosing himself or herself with a particular condition, and actually the individual is suffering from other disease, so incorrect self diagnosis, which leads to delaying the treatment, that is delaying in seeking the medical advice when needed. Then sometimes self medication leads to dangerous drug interactions. Also, if the individual takes the drug in incorrect manner of administration, that is incorrect dosage and incorrect choice of therapy, all these things are detrimental for the individual. Then self medication can mask the severe disease which is underlying, that is, if sometimes that is basically self medications will manage the symptoms, but it will not cure the disease unless we know what is the pathophysiology behind that. Plus some of the medications are having high risk of dependence and abuse, so that is also a disadvantage of self medication, that is a risk associated with self medication. So here you can see some of the potential interactions, that is example of potential interactions where we are involving some of the non-prescription medication. So here you can see like aspirin, this is the non-prescription medication. Then we have cimetidine, which is H2 blocker. Then we have fluconazole, ibuprofen. So all these are non-prescription medications, but these medications can lead to severe drug interaction. Suppose if the individual who is having aspirin is also on warfarin, then it leads to increased risk of bleeding. If the individual who is having cimetidine and is on warfarin, again it leads to increased risk of bleeding. Then valproate, it increases the toxicity. Suppose the individual is on fluconazole already and now individual takes sulfonylurea, then in that case it can lead to hypoglycemia. Then ibuprofen, when given along with simvastatin, it can lead to myopathy, that is statins induced myopathy. Then warfarin, there is increased risk of bleeding. Then lithium, there is increased chances of lithium toxicity. So all this occurs when we take these non-prescription drugs without knowing that they have interactions with the already prescribed drugs by the physician for the particular condition. If the individual is already on this drug and then he or she takes any of these drugs, these are some of the examples, without even consulting the doctor, so it can lead to these possible outcomes, which are increased risk of bleeding, then hypoglycemia, myopathy, increased toxicity of that particular drug. Now coming to the responsible self-medication practices. So as I have already mentioned, like if we are doing responsible self-medication, then it can act as an advantage for the individual. It can also act as an advantage for the community also. So what are the responsible self-medication practices? So first is reading and understanding the medication levels and instruction, that is basically how to use it, where the drug is contraindicated. Then to know when to stop self-medicating yourself. So now let's discuss about these 2 points in detail. So first we have reading and understanding the medication levels and instructions. So labeling for prescription medications is basically FDA's primary tool for communicating the drug information to the healthcare professionals, to the patients, and the caregivers. So, from the labeling, the individual who is the patient and the caregiver of the individual, also the healthcare professionals, all get information about that particular prescription medicine. And labeling is required for all US FDA approved prescription medicines. So, under labeling, we are having several categories. So we have medication label, we have patient package insert, we have medication guide. So let's discuss about these three. What are these three? That is medication label, then patient package insert, and then we have the medication guide. So first we have the medication label, as you can see here. So medication label basically refers to the printed information on the bottle, box, or packaging of a particular medication, as you can see in some of the syrup, then you can see in the tablet strip. So what are the key components of this medication label? So first thing is the drug name. That is, it will include the generic name as well as the brand name of the drug. As you can see here, this is azithromycin. So basically this is the generic name of the drug. Okay, then the dosage instructions, that is the dose to be given, the frequency, the duration, and the dosage form. So here, as you can see, it is for intravenous infusion. Okay, the dose is given, that is how much is the dose to be given, so and how you have to give this, that is basically to constitute, as you can see the instructions, in constitute 200 milligram per ml with 4.8 ml of sterile water for injection. So it is given by intravenous route, that is intravenous purpose. Then route of administration, that is intravenous. Then warning and precautions are being provided. And coming to the storage instruction, as you can see here, that is stored at 20 to 25 degrees Celsius or 68 to 77 Fahrenheit. So this will basically guide us guide us about the storage conditions for that particular drug. Then indications for the use of that particular drug will be also provided. Then we have the expiration date, as you can see, that is expiry date. Then manufacturer information, that is you can see the batch number and all. So it is distributed by Sun Pharmaceutical Industries, manufactured by Sun Pharmaceutical Industries Limited. So these are the informations. Then apart from this, they will also have special instruction for use, plus for controlled substances. So controlled substances are basically the substance which can cause addiction. So in that case, we will have the controlled substance symbol, as you can see in this image. So this symbol is for the controlled substances, and inside this we have the Roman numeral which is indicating the substance schedule, that is schedule 2, and C means it is a controlled substance. As you can see here, buprenorphine and naloxone sublingual tablets, and here we have the symbol for the controlled substance, that is it can lead to abuse and addiction. Then coming to the other types of labeling, so we have patient package insert, and then we have the medication guide. So patient package insert is a detailed document that provides information about the prescription medication that is typically provided with the medications approved by US FDA, and medication guide is a document that provides information on how to safely use a medication, and it is typically given to the patients only when they pick their prescription, that is given by the pharmacist. So unlike the patient package insert, the medication guide is not as described as the patient package insert and may be required for the drugs, some of the drugs only which are approved, some of the specific drugs approved by FDA, especially those who are having high risk of adverse effects or misuse or potential harm. So medication guide is not that detailed, but the patient package insert is comparatively more detailed. Medication guide will be provided to the individual when the individual is going to take the medicines from the pharmacist. So here you can see this is the medication guide, and inside this you can see is the patient package insert. So the patient package insert and medication guide are both primarily meant for the patients, with the patient package insert being more comprehensive and educational, while the medication guide is mainly focusing on the safety concerns, and it is comparatively less detailed than the patient package insert. And the medication label, which I discussed earlier, that is which is present on the packaging, on the bottle or the strip, that is intended for both the healthcare providers and the patients, which summarizes the essential details for the safe use of that particular medication, like where to store the medication, what is the indication, what is the dose, what is the route of administration, how frequent you have to administer that drug, what is the manufacturer details, what is the expiry date of the particular medication. Now the next thing, that is to know when to stop self-medicating. So when the symptoms of a disease persist for more than a few days without any improvement, or if they are severe enough to interfere the daily activities of the individual, then you should stop the self medication. If the individual is having warning signs and red flags like difficulty in breathing, severe abdominal pain, unexplained weight loss, or changes in the consciousness, in that case also you have to stop self medication. If the individual is suffering some of the chronic conditions, then in that case we should stop self medication, because in that case the self medication can mask the underlying condition. Then when the individual is taking multiple medications, then there can be increased chances of drug to drug interaction, so in that case also we should avoid self medication. If the individual is a high risk individual, that is basically if the individual is suspected to have pregnancy, in that case also we should avoid self medication, that is the lady should avoid self medication in that case. And sometimes this self diagnosis can be dangerous, and it can lead to perception of a different disease and can delay the proper treatment for the particular disease. So in that case also we should stop self medicating. And if the individual is having a medical history of allergies to different types of drugs, in that case also we should avoid self medication, because we never know that individual might develop some of the severe reaction, adverse reaction like Steven Johnson syndrome, toxic epidermal necrolysis to some of the drugs which are related to the drugs to which the individual is already having allergic history. Now coming to the ethical responsibility associated with self-medication, as a medical student, what is to be done, that is the ethical responsibilities of the medical student, that is they should be aware of the benefits and the risk of any self-medication, as I have already mentioned in the previous slides, and they should know about the self-medication, that is it is going to lead to drug resistance in some of the cases. One of the common example is development of the antimicrobial resistance because of the irrational use of the antibiotics. They should educate others about the self-medication and their adverse effects, and should not self-diagnose or self-treat conditions which are associated to mental health mainly, because in that case it is very important to seek the attention of a registered medical practitioner without going for self-medication. And they should be vigilant about the potential substance misuse tendency, that is basically some of the drugs are having substance abuse potential. So if the individual is self-medicating himself or herself with that particular drug, it can lead to even drug abuse. So these are basically the ethical responsibilities of medical students related to the self-medication practices. Now coming to some of the case studies where the self-medication has caused havoc. So as you can see, this is the first case, that is pantoprazole induced Steven Johnson syndrome, a case report. So in this case, it basically highlights the possible occurrence of hypersensitivity reactions like Steven Johnson syndrome due to the use of proton pump inhibitor, which is usually a very safe drug and widely used as a self-medicated product. So this is one of the case. Then we have the next case, that is self-medication which has led to complication in the pseudomembranous conjunctivitis in an individual. So this is also a case report. Then we have other cases like serotonergic and cholinergic syndromes, which is associated and induced by self-medication. That is, in this case report, they have shown the self-medication of fluoxetine and dimenhydrinate in an older adult can induce serotoninergic and cholinergic syndromes, like it is basically displaying symptoms like nausea, tachycardia, tremor, loss of appetite, decreased vision, increased urination. So these drugs, that is fluoxetine and dimenhydrinate, can lead to these conditions if that is basically in this case the individual self-medicated themselves with fluoxetine and dimenhydrinate and they landed up with these symptoms. So finally coming to the conclusion of this presentation, so as future medical professionals, we need to prioritize accurate diagnosis and evidence-based treatment over quick solutions, that is to get quick relief from the symptoms. So it is important to develop skills to counsel the patients about the dangers of self-medication and the importance of professional medical guidance. But in contrast to this, if the individual is doing responsible self-medication, then it is not that detrimental also. So basically self-medication is a double-edged sword, as I have already mentioned. Like if you are doing responsible self-medication, then it can be beneficial, but in most of the cases, suppose if the self-medication has led to the delaying of the treatment, then it is basically a disadvantage in that case. So this is about the self-medication. So these are the references which I have followed. So with this, I would like to end this presentation. So I hope you like my content. If you like my content, please do like, share, subscribe, comment, and also press the bell icon so as to get notified whenever I upload a new video. Thank you guys.